So SUI, or stress urinary incontinence, is the involuntary leakage of urine. So leaking urine at a time where you don't really want to, generally related to maneuvers like coughing, sneezing, laughing, bending over, things like standing up from being seated. Those are things where typically between the prostate and the muscle that helps hold urine in, we would not see guys have leakage. However, with certain changes in either quality of the muscle that's there, strength of the muscle, or removal of the prostate, we do see changes that cause that leakage. Stress urinary incontinence is most commonly found following prostate surgery. We tend to think of it mostly after prostate cancer surgery. However, we will see it after prostate surgery used to treat an enlarged prostate. Additionally, we will at times see stress urinary incontinence occur with neurologic injuries, such as back injuries or prior back surgery. And at times we can see it following radiation therapy as well, as the radiation therapy may weaken the muscle that helps to hold that urine in when we cough, sneeze, and laugh. There are many ways to diagnose stress urinary incontinence. Some of them are really simple. It's that patients come up and they tell us exactly what they're experiencing. Hey, when I cough, particularly if I have a full bladder, I'm going to leak some urine. I have to wear a pad now where I did not wear a pad in the past. There are times where we may do what's called a standing stress test in the office. It's where the bladder we anticipate will be moderately full. We'll have the patient stand there and cough or sneeze. By doing so, we generate pressure in the abdomen and see how much leakage can be present. Some physicians may ask you to collect the amount of pads that you have during a day and measure the weight of that pads. I personally prefer to actually just ask patients how many pads are they using, what are the size of the pads, and how full are they when that occurs. Additionally, when we start to look at treatments for stress urinary incontinence, we may elect to do what's called a cystoscopy. A cystoscopy is taking a small little camera, going up into the bladder, and then on our way out, asking the patient to clamp down on that muscle you would use to try to hold the urine in, and trying to assess how strong is that muscle at this point in time. I do recommend to patients that they see a specialist for stress urinary incontinence. While it's very typical that patients having prostate cancer surgery are going to have some leakage, and it very much will often improve with time, it does not for all men. And while, yes, it is a known side effect of that treatment, it's not something that patients need to live with. So I think finding someone, and if not a specialist, finding somebody who's going to be reactive and actually take the incontinence component seriously rather than just assuming that it's going to be a side effect of the procedure is important for patients and is important for them to realize what options are out there for their treatment. Well, the good news is we do have a lot of different treatments for stress urinary incontinence. Some of them are very simple. There are essentially little pouches that will sit over the tip of the penis. So for patients that don't have very high volume leakage, that could be enough to keep their pants dry and to keep them from having too much difficulty. For some patients, they'll just use pads, or even depending on the scenario. Other patients will actually use a clamp. There's a clamp that can kind of go over the penis, which will help hold the urine in, and then when the clamp's open, generally what urine has gotten past that muscle will immediately drain out. For some patients, we'll use bulking agents. So when we start to look at surgical options, we may use bulking agents to try to inject to provide a little more back pressure and minimize the leakage of urine. There are physical therapy type training that we can put patients through, using biometric feedback and making sure that they're constricting and tightening the right muscle when doing Kegel exercises goes a long way into how well that exercise is effective. And then finally, we have some patients that ultimately will undergo a surgical type approach. And the surgeries are very, very effective at this point in time. We have male slings. And the good news is the male slings don't have some of the same problems that you may have heard of with the female slings. We don't tend to see the mesh erosion or issues along those lines. They can work quite well, however. And then we also have artificial devices that are cuffs that go over the urinary channel to help try to hold the urine in. Picking the right one for you is important, and each patient may have a slightly different aspect that's important to them. One of the biggest questions to always understand and always to verify with the physician is, what's this going to mean as far as dryness? It's important that we understand, does the patient want to be completely dry, or are there stages which would be appropriate as well? Determining which is the best treatment option for each individual patient is where some of the expertise comes into play. And one of the biggest components of that is going to be having a full understanding of when, how often, and how much the patients are leaking, plus an understanding of what the patient is going to consider a good outcome. It doesn't do me any good to try to get patients to about a 50% improvement if that's not going to meet their desired end goals. Additionally, there are times where maybe it's not best to shoot for completely dry because it's an over-treatment that may lead to more surgeries down the road, when in all reality, patients just need to be dry to the point where one minor pad is utilized. These are the discussions that are going to go into evaluating and discussing and determining what is the best treatment. Additionally, I want to know and make sure that the patients are able to constrict their external sphincter, the muscle that helps hold the urine in well. So we'll often do a cystoscopy to take a look at that. And I often want patients to go home and try to urinate and start and stop their urinary stream. For patients that can start and stop their urinary stream with that muscle, then a male sling ends up being a very good option. For patients that are leaking consistently at night or are not generating a urinary stream at all and are floridly incontinent, meaning just leaking all the time, the male sling may not be the best option, and we might want to look at more of an artificial sphincter in that setting. But really, when it comes down to it, this is going to be a discussion. This is a discussion between myself and the patient in determining really how are we going to meet the needs and the goals for each individual patient. For most patients, the long-term consequences of not treating the incontinence are going to be things like irritation of the skin, more likely to have growing rashes, potential infections under the foreskin, more likely to have or to be bothered by a potential odor, or to feel like they need to change their lifestyle to fit with trying to minimize that incontinence. We do not want men trying to limit their water intake all day long, trying to limit the incontinence. That's not a healthy thing for most men. So from a long-term consequences, a lot of it's more irritative type things, but it has a very profound impact on how comfortable guys are going out, doing different activities. For men that are leaking that won't pursue exercise, that's not a great option, because we want men to be active. We want them to be healthy all around, and treating the incontinence may help them get back to that activity.